One. And we are live with Ilias Ravanta. Ilias, how are you? I'm doing great. Are you actually in Finland right now, or are you in the US? I was interested, and so would that be considered kind of South Central Finland, or how do the Finlanders think of that, the town?
Yeah, I guess that would be a good description. We are considered to be in the south, but yeah, South
In one of
Central.
Yeah, in one of the larger towns, second largest, is that right?
Yeah, yeah, it's actually one of the largest cities here in Finland. I mean, I bet we're not that big of a country, so there's only 5 million people in Finland. So the cities are.
Yes, roughly, well, a bit smaller than Minnesota, where I'm right outside of Minnesota, so roughly the same population. Yeah, I haven't looked for geography. So, Ilias, want to talk to you today. You and I had met very briefly at a Medical Alley event, and you gave a presentation on antibiotics and antimicrobial resistance that's happening around the planet, and I looked some of those statistics up, and as recently as 2023, it looks like reported almost 5 million people around the globe are dying from antimicrobial resistance, and so we have an issue with overprescribing of penicillins and antibiotics, and we certainly have issues in the U.S. with that. We have issues with patients not taking their full course of medicines, and that resulting in antimicrobial resistance. Is that problem accelerating or decelerating in 2025, or what is the state of antibiotic use, antimicrobial resistance around the planet right now?
Say that unfortunately it hasn't been decreasing. So the projection right now, the number that you mentioned, 5 million, is associated with with antimicrobial resistance. So that's the associated deaths. Direct deaths are around 1.3 million from no drug working anymore. So the projection for that is in 2050, we keep going at the same pace that we're going, it's going to be 10 million, surpassing cancer, surpassing car accidents, actually becoming the number one reason of death in the world. So there's measures that have been taken. I mean, but this is an issue that has been talked about on governmental levels, on many different levels for decades, and still we keep going at the same pace and same rate. There was I can't remember the professor from Cardiff who mentioned that it's a slow tsunami. Well, everybody sees that it's coming, but we're not doing the necessary things. So right now, I think it's time for action, and we need tangible solutions that can start curbing that, start experiencing the gruesome effects of antibiotics not working for very common diseases.
Yeah, which of course many of us don't remember the days when we didn't have antibiotics. That was in the 20s or 30s that penicillins, antibiotics started. And by the way, full disclosure, I just did a quick AI search on my numbers, so that's if they didn't match the CDC or World Health Organization. That's why I was doing a podcaster's version of research on that prior.
Yeah, yeah.
Um, is the issue better in the U.S. and Europe? Are we getting better at educating our physicians and our people? In your mind, is it a physician issue, or is it a patient issue? A patient goes to the doctor and says, "Listen, I'm desperate. I have a problem. I need antibiotics." Does the blame lay on one side or the other, or is it just the system?
Well, I'm definitely not here to point fingers and put blame on anybody, but I can definitely talk about the effects, and one of the biggest reasons why this is happening is because we're so accustomed to getting antibiotics. So the patient expectation is definitely one of the biggest, if not the biggest reason unnecessary antibiotic use. It's also the system. It's also the status quo. It's doctors have been doing it for a long time. I was just talking with a doctor while I was there in Minneapolis about this, and he mentioned that one of the biggest hurdles that they see in these usually these common infections, which is ear infections, sinus infections, upper respiratory tract infections, which are the biggest reasons why antibiotics are being given out. So it's the patient expectation when the patient comes in, and it's understandable that they want treatment. I would say that we're still lacking on the understanding of viral versus bacterial, how antibiotics only work on the other one, the bacterial. It does nothing for viral.
Yeah, and I should say I'm very sympathetic. I have physicians that are friends of mine and physicians in the family, and they want to help, and they have people coming to them who are desperate and they're miserable, and they don't always have the right tools to properly diagnose whether it is viral or bacterial, and so they're in a system that is overloaded with their schedules, and so they make a risk-based decision to provide an antibiotic if it's close or if it's going to make their patient feel better. And so one piece of your solution for sinusitis uh, is the evidence-based element that is behind it. And so tell us a little bit about what you're doing to help, provide physicians with good information that can also help a patient understand what they're how and what they're going to be treated with.
I'd love to. Sinusitis or sinus infections are very common. They're actually the most common reason for which antibiotics are given in the whole world. In US, but in the whole world as well. In US, roughly 30 million people get a diagnosis for sinus infection. In globally, sinus infections or sinusitis affects roughly 800 million to a billion people every year. So it's a very common disease. What we do, and we've been doing this in Finland for over 40 years, we use ultrasound to see whether or not there is fluid within your sinus. So we focus on sinus infections or sinusitis. So what we do is we use a simple handheld ultrasound device that sends ultrasound towards your back wall of your sinus to see whether or not there's fluid within the sinus. When there's fluid within the sinus that can be picked up by ultrasound, it's a very strong possibility that there's bacterial infection involved, but even more so. And this is, I have to quote Dr. Tierney, who's a doctor from Minneapolis who's done a study on this, a very good study, and everybody who's interested should go read Dr. Tierney's study. They were able to show that when they introduced point of care ultrasound, so an ultrasound into their workflow, they were able to cut back antibiotic prescriptions by half, and they were already at a very low curve in their prescription rates. So what Dr. Tierney said was that when there is no fluid within the sinus, so you get an air echo, he used a reference that, in an empty lake, the bacteria don't grow. And I think that was ingenious. It's exactly so. When there's an air echo, your sinus is filled with air. There's absolutely no reason to give antibiotics for sinus infection. And in most cases, because sinus infections are predominantly viral, depending on the study, it's between 90 to 98% of all sinus infections are viral. So only 2 to 10% of these diseases, very common diseases that the doctor sees, are bacterial. So you should be giving out antibiotics for maybe, 1 in 10 cases, maybe 2, something like that. And yet right now, I just looked this up because I knew we were going to be talking about this. The most recent study coming from US, and this is US numbers. You asked me if the situation is better in US or Europe. Unfortunately, it is not. I mean, even more so in US. the numbers for sinus infections, how many people get an antibiotic? The study was released 2024. It's 83%. So for a disease that's over 80% or over 90% viral, 83% get an antibiotic. And
And
that's where
so,
we come in.
so just I want to back up just a little bit. Dr. Tierney's study, for those people listening that want to take a look at that, is where would they find that published? Can they just Google Dr. Tierney
They can,
sinus study, or how do they find that?
yeah, they can, if you put in Dr. David Tierney and POCUS, which is POCUS, POCUS, and sinusitis or sinus infections, I think you're able to find it.
And is it a
So it's
peer
a,
study?
I think it's a prospective study. So what they did is they measured the effect of ultrasound use in their internal outpatient clinic for initially for a year and then for 3 more additional years to see what the effect is. And they were able to prove something that we already known in Finland since, well, I would say late 90s, mid 90s. There's a study that comes from Finland in 2003 where they were able to show that if you compare, clinical impression, which is symptom-based diagnosis, with an ultrasound aided diagnosis, 50% of those done purely on symptom-based were wrong. So it's flipping a coin. Dr. Tierney was able to demonstrate that they were able to cut back 50% of those antibiotic prescriptions when they used ultrasound, which is a very fast examination. I mean, I think he mentioned 3 minutes. I can say that with our new device or sinus, we can do it under a minute. So it's a fast procedure that you can incorporate into the doctor's workflow. Very easy to use. And they were able to not only cut back by half on antibiotic prescriptions, they were able to reassure the patients because they had something tangible that they were able to show from the monitor that, hey, right now, in this case, we're not going to be giving you antibiotics for sinus infection because you can see here that there's nothing there. And the patient felt like they got something instead of the doctor saying just, well, probably not today. It doesn't look like you need it. Now you had tangible evidence.
Yeah, like as a patient, I can tell you that is the difference in my mind is very significant. If a doctor does a test and there's results, it's just so much easier to believe. I think we all know that we all can be wrong, including doctors. But when a test has been done and then there's a result, it just makes it much easier to believe what is you're being told, and then deal with it however appropriate based on the test results. So I totally get.
Yeah, I think it goes broadly for us humans that when we see evidence of something, it's a lot easier to believe what somebody's saying.
Elias, for hospital and clinic systems that have interest in the tool, can they get it in the U.S. currently? And do you see any other applications for it at this time, or has it primarily been used for sinusitis or sinus infections only? Yeah, does the device have any other uses? Are there any other infections that relate to fluid being present versus not present?
Well, we're looking into that. We have a few other things that the ultrasound technology platform can be used for. There's something that in the first application will be for sinusitis and sinus infections, and then we're looking into other application areas as well. And we're very interested. We were chosen. We're one of the 11 companies chosen from Finland in a cohort for an accelerated U.S. market entry program that's run in collaboration with Mayo Clinic. So we're very interested in this cooperation possibility and seeing how we can advance on the sinus infection treatment and also with the other application areas that our ultrasound technology could be of help.
That's great. Yeah. So before we close, I just want to point out, so Finland has used this product as the standard of care for years, and it's been very successful. I find that to be very persuasive. You're going through the FDA process. For people that have more questions, can they reach out to, and your company is Orcasun, is that how you say it? So orcasun.com, for people that have interest, they can go online and take a look, and they can get a hold of you if there are, leaders in supply chain for hospitals and clinics or physicians that want to talk to you. Is that right?
For sure. All the information can be found on our website. There should be my personal email on the website as well. I can be contacted via telephone or email or on LinkedIn, wherever I'm found the best. Let's put it out.
Well, this is an issue that is impacting all of us, will impact all of us as we go forward, will impact our kids and our grandkids. I think it's critically important. So thank you for taking your time to talk to us today. And for everyone else out there, thank you for listening to the vodcast. Thanks, Elias.
We appreciate it, Kelly. Thanks a lot.
Yeah, have a good day.
You too.